So we are really super delighted to have Anita McGahan, one of our faculty affiliates, speaking today. Anita is a university professor at the Munk School and at the Rotman School, where she holds the George E. Connell Chair in Organization and Society, and in her research focuses on industry change, sustainable competitive advantage, and the establishment of new fields. Look, I think we're looking at establishing new fields here, and an area of particular interest in global health and the diffusion of knowledge across international boundaries. And I think that's going to be obviously very related to her topic for today on mobility and proximity in Canada during the COVID-19 pandemic. So Anita, you can take it away.
Thank you so much, Jillian, and thank you everyone for being here. I know how busy everyone is these days, and it's really wonderful of you to join, so thank you so much. And please don't hesitate to jump in if you have any questions here. So what I want to do today is talk with you about three things. First, I want to give you a brief overview of two research projects that I've done in the impact of COVID. I've done a couple of others as well, but there's two that I wanted to present today. One of them is on COVID policy effectiveness, and the message from that is a relatively grim one, as I'll explain. Basically, this is a Bayesian model that I did with some friends, and it shows that some of the foundational or core policies that were being implemented in most jurisdictions that were pursuing COVID control in Europe and North America, that they weren't going to be enough. This is a paper with analysis through September 30th, that they weren't going to be enough to stop the wave that we're currently in. So it was kind of a bad news message. The second paper is on Canadian mobility and proximity, and that's an analysis that had sort of a good news message. It showed that Canadians were maintaining social distance. And then finally, I want to talk a little bit about the experience that I had in disseminating these findings, and in particular in dealing with the media. I was just talking with Jack as we were getting started before our call, and she mentioned, the first thing she said to me, Jack, I hope you don't mind that I'm sharing this with everyone. The first thing that she said to me was, I saw you on TV last week. I saw you on the news. I heard you on the CBC and so on. I just got overwhelmed, really, and I actually really don't enjoy being on the news at all, but I got overwhelmed with media requests about this story, and I had a lot of difficulty trying to stay really close to what the research actually generated in terms of finding. And so I want to tell you a little bit about that and perhaps ask for your thoughts about that, because one of the really wonderful things for me about being part of SRI and experiencing our research seminar series is in learning just so much from all of you about research ethics, about the issues associated with big data and analysis, the biases that can be introduced, and the translation of our findings from research to public policy and to disseminate them into the public. And I'd love your thoughts about how I can do better at that. So let me tell you first about this first paper, and I'm not going to go through all the details of the paper. I just want to give you an idea of what it's about so that you can get a sense of some of the struggles that ensued with regard to disseminating the findings that I want to talk with you about as well. So this is a paper with two junior authors who are both brilliant and amazing, Faber Wibbins and Wes Koo. Both of them are at INSEAD, which is a business school that's in France and in Singapore. And this is a Bayesian analysis of COVID-19 policies by jurisdiction. And I'm going to show you the main results and give you an idea of this here. And we started this project back in April. The papers are in art at +1. The second round, it's in the second round now of peer review. And we are just so frustrated by the delay, because we pursued this project because we felt it was so timely and important. The sources of data are public data, and I put links to all these data sets into the chat before we got started. So if anybody actually is interested in this data, you can get access to it. We use the Oxford policy data. I'll explain a little more about that in a minute here, but basically we use 8 categories of core policies, and from the Oxford policy data. Oxford is now kind of the gold standard on policy. There's some arguments about that, but most Bayesian SEER studies such as ours use Oxford policy data to measure by jurisdiction, or to assess by jurisdiction, the restrictions that have been put into place. Examples of these kinds of restrictions would be like, you can't hold a public event with more than 10 people. You can't have gatherings indoors of more than 10 people or 25 people. Restrictions on cross-border closing, school travel, contact tracing. Those would be examples of policies, and we're going to examine those by jurisdiction. We use the Johns Hopkins COVID dashboard data on infections and deaths by jurisdiction. And then we use the Economist Weekly Report on excess deaths. So these would be deaths above what would have been expected had there not been COVID. And we use that to estimate, unidentified or non-identified COVID deaths in our analysis here. And this is just an example. This just shows the Oxford policy data. So for example, what we're going to have here is for each of 11 different policy categories. The first one here, and I apologize for the small type here, but the first one is on school closings and university closings. We have up to 4 measures of policies for jurisdiction. One is no measure, 0 is no measure, 1 is recommending the closing, 2 would be requiring the closing of some levels or categories like just the high schools or just the public schools, and 3 is require closing all levels. Same thing on closings of workplaces. Are they recommended, required for some, or required for all? Public events, private gatherings, and so on. There are also over here on the right-hand side, health policies like public information campaigns, starting with public officials urging caution and going through coordinated public information, recording government policy on who's being tested, essential workers, people who have symptoms, and so on, and then contact tracing. So you get the idea here. These are the kinds of policies we're looking at here, okay? The coverage here in our analysis is 11 types of COVID control policies, each at up to 4 levels. So if I go back here for a second, underneath the Oxford policy list, we can have up to 4 policies. For example, on private gatherings, there are 4 levels of policies, okay? Here, on, importantly, international travel, there are 4 levels of policy. So 1 would be screening arrivals, 2 would be quarantining arrivals from some places like China, 3rd would be banning arrivals, and 4th is banning on all travel. Okay, in Canada, we have had that for a while. Right, so it's going to turn out that we have 11 different policy categories, but multiply it by, 3 or so different policy levels. We have about 30, 35 different potential policy level, category levels, okay, that we could implement. And then we are going to look at 38 countries and US states for our analysis here over time from the beginning of the pandemic. And we're going to model that in our Bayesian model. So just to give you an idea here, this is a list on this axis here. Can you see my arrow, Jillian?
Yeah, Anita, Ron's got a quick question, just clarification. Sure. Or
yes, please.
A few months ago, I was looking at mask use, and I noticed that it wasn't in this data set, and it looks like it still isn't. I was a little surprised by that, since there's a lot of speculation about how impactful mask mandates are. Did you look at that, or what are your thoughts on that?
Yeah, so most people interpret the public information campaign policies as relating to mask wearing. Okay, so under the public information campaigns here, in the Oxford data set. So you're right, there is no mask wearing thing in the Oxford data set, but under public information campaigns, there is urging caution, and then public media, public information. I think they now have a 3rd category, which is public information requiring distancing and mask wearing. So I think it's most, it's like urging caution included urging us to wear masks. Coordinated public information campaigns was public information about mask wearing. And now I think a lot of people have a 3rd level there, which is requiring it. Okay, but yes, you're right. It was slow to come. Absolutely. You know, this is one reason why the Oxford categories are not, they're considered sort of the gold standard, or I don't want to call it a gold standard, but a standard, you know, for analysis. And what Fabo and Wes and I were trying to do in this paper was use the classical or standard sources of data, okay, so that our findings, which basically I'll show in a second, which were not great news, you know, could be sort of understood or interpreted or synthesized with those of other Bayesian modelers who might, you know, have come to different conclusions, so that we could have a public conversation about this. So both of the papers that I'm presenting you and giving a flavor of right now were designed for public dissemination, okay? And that's why we use the Oxford criteria, but there were some disadvantages of that for sure. By the way, I should add, just while I'm on it here, I have also put into the chat a link to a little online tool that Fabo, the modeler in our team, developed, where you can put in a jurisdiction and test and look at what types of outcomes you would get if you had different levels of these policies. Okay, so what we were trying to do here was really inform public policy with this analysis. Jillian, please, if you don't mind, don't hesitate to interrupt me anytime anyone has a question. I'm very, very happy to do that, or whatever you feel is appropriate.
Great, and I'm keeping an eye on the chat, so you don't need to worry about that, and I'll interrupt you and bring it to your attention if there's something.
Super, thank you so much, and thanks, Ron, for the question. Okay, so here what we have across the top is our different categories of policies across the top, and you can see, Jillian, my arrow. Not really.
Yes, I can.
Okay.
There might be a tool somewhere else at the top.
All right, it's not so important,
arrow,
but you can see they start with school closings, workplace closings, and so on, all the way to contact tracing on the right-hand side. And then we have a list here of the different jurisdictions that we studied, including also U.S. states, the U.S. states here. And we didn't include all of the jurisdictions that are covered by the Hopkins data set, but what we ended up doing was we wanted to use excess deaths, and the Economists doesn't report excess deaths for all jurisdictions. For example, it doesn't report it for Canadian provinces. We did do an analysis that included Canadian provinces, but we couldn't do excess deaths. So that didn't make it into the final version of the paper, but we can talk about that if you're interested in due course. Okay, so what this chart shows is for each category of policy, the level of the policy over time with increasing levels of darkness in the bars to reflect the strictness of the policy. Okay, with a level 1, 2, 3, 4. So the light, let's look over here at H2 testing policies for Austria. The lightest level here represents level 1. Level 2 is the orange, the light orange part. Level 3 is the dark orange part. And Austria never got to level 4. Well, there is no level 4 on H2 testing anyway, but level 4 would have been represented by red. Okay, and I just want to point out that there isn't tons of variation in some of these countries over time. You see, for example, in US states, we're pretty much at level 2 on school closings, which is to close partial school closings over time. And then a lot of jurisdictions went to restrictions on gatherings. This is gonna, that lack of international travel controls, for example, you see across all US states, the same level of international travel controls here. I should have said over time, I don't know if I forget if I did. These bars represent the unfolding of policies from March 1st through September 30th. Okay, so it just gives you the sense that I just wanted to point out that, you know, you're not running the whole gamut of all the policies in each category over time. So that's an important thing for me to say here. In other words, red on C4 here is not comparable to red on H2 because there is no red on H2. H2 is a testing policy. So there's no absolute level of comparability between levels of policies across these categories. Okay, the modeling, this is my only slide on the modeling. I really am just going to go straight to the results here and show you that. But basically what we did in our SEER model is we said, okay, let's look at the overall portfolio of policies adopted by each of these jurisdictions, such as Austria, across all 11 areas. The levels at which those policies were implemented. We're going to look at the rigorousness of the compliance within the jurisdiction. We modeled that. That's not something I'm going to go into in depth here, but we can see we are able to model and estimate, for example, in Canada, that there was higher levels of compliance with the recommended policies in Atlantic Canada than there was in Quebec and Ontario at the very beginning of the pandemic, and that had consequences for subsequent infection. Okay, we're going to look also, of course, at the jurisdiction's level of infections, death, and excess deaths, and the performance of. We're going to have the model balance estimates within a jurisdiction with estimates of the effectiveness of the portfolio of policies in other jurisdictions. Right? The model, I put in the links to our parametrized model and to the code in the chat if you're interested in this, but I want to just show you what the results are here. So what we found here is across the 11 categories of policies, from school closings to workplace closings to canceling public events through to public information campaigns, we're on for that. You can think of mask wearing, through testing and contact tracing. We found that the greatest marginal effect on weekly growth rates in infections came from a combination of restrictions on internal movements, stay-at-home requirements, workplace closings, and school closings. Now, this is marginal impact above a baseline level of, above the average amount of policies that have been implemented. So we can't take from this that you shouldn't do mask wearing. Okay, what we're going to say here is that a little bit more restrictions on internal movement can deliver more impact. And in this instance, it's at level 2 here. And in fact, our overall findings here emphasize that core policies are also important. So let me go back here for a second and explain how to interpret our results here. So we identified a basket of core policies across these 11 categories that were sort of foundational for achieving a stability and the growth of COVID infections. And they are, I'm going to sort of say this fast, it's very intuitive. They are canceling big public events, limiting gatherings to under 10 people, small gatherings to 10 people, restricting cross-border travel, recommendations of stay at home, banning arrivals from some regions, having a coordinated public information campaign that recommends mask wearing, having comprehensive contact tracing, and testing anyone showing symptoms. So these are level 2 or 3 level policies pretty much across the board, okay? We're going to call those our core policies. Core policies. And what we find here is that you don't get a reduction in weekly COVID infections to a level of 0. In other words, you don't stop the growth of COVID infections with only the core policies unless you're in the best 10% of compliance. Okay, so if you use these relatively straightforward, least economically painful, most tolerable core policies, you have to be Switzerland or Atlantic Canada in order to get your baseline level of infection growth below 0 and control the pandemic. Okay, so that's our that's where we start. If you are at the median, like Quebec or Ontario, or in a bad situation like some US states, like Florida, during the time of our analysis here, you have to go further and implement these much more challenging policies in order to get COVID control below, COVID control to occur. In other words, to get infection growth rates to zero. Okay, and those include restrictions on international movement. C7, this is the first one, which is restrictions on travels between cities and regions, requiring closing for all but essential workplaces, requiring not leaving the house with some exceptions for daily exercise and grocery shopping and essential trips, banning travel, and these are in order of effectiveness, and then school closings. And these are very painful things to implement, but if you don't get compliance with the core policies, this is what you have to do. So it's a bad news story, okay? And this paper is, as I said, has generated some response. We've gotten some interest in it. It's been discussed in some places. We had it up as a working paper for a while, but it has not nearly had the same media attention and response as the good news paper that I'm about to tell you about now. Jillian,
Anita,
I just want to
yeah,
pause.
I'm gonna go to Ron again. Ron, you want to get your point in?
Yeah, I think while you were presenting, we were having a little chat about the granularity, right? I think the standard data set is coarse grained, and Laura was pointing out with masks that hey, a lot of mask mandates are not at a state or province level, and indeed, I think a lot of these rules can vary quite a bit, right? Many places went to phased reopenings, and different parts were at different stages, right? So I wonder, if some of the big variation you saw between best and worst had to do with something, like variations that weren't visible at the granularity of a state or province.
Right. So for sure, that's true. That's true. What we tried to do was limit our analysis to jurisdictions where there was an alignment of the jurisdictional boundary with the policy. In other words, in Austria, you have country level policies, okay? That's why I went to US states, because there was no real, in my opinion, coherent federal policy in the United States. It was governors that were of the US states that were implementing these different policies. But it's one way of interpreting our results is that you don't get strong compliance in a particular jurisdiction that we modeled because of demographic diversity within the jurisdiction.
But like even within a US state, many states had quite a wide variation by county or even city, right? I mean, there's been news of fights between mayors and county officials and governors over what rules should prevail, right?
Yes.
Which is messy.
You could interpret, that fighting as problematic here, as one of the reasons why there isn't that kind of uniform compliance in a particular jurisdiction. So with this, what we're saying is, if you don't, basically the policy implication of this, if I could just sort of be crass, is you got to get compliance, because if you don't get compliance, you're going to have to shut down more to control growth. And so if you want to only have a tolerable level of core policies, you've got to get your freaking act together, governors, and city leaders. You have to harmonize here. You have to deliver consistent messages so that the people we've heard even in prior SRI talks that consistency in messaging is critical to compliance. If you have arguments between leaders in different parts of a US state, it's really hard to get people to comply. So a policy implication of this would be that, you know, that whatever's causing the problematic compliance needs to get addressed, or we're going to have to go into much more severe lockdowns, you know, or restrictions.
There's a couple of other questions in the chat here. Rhonda, did you want to ask yours?
Yeah, sure. I'm also doing some work on COVID high, and I've been focusing on contact tracing. So when you kind of came down to the jurisdiction quartiles and you were looking at the growth rates vis-a-vis some of the policy, I wondered where contact tracing sort of falls.
So contact tracing is one of the policies that we studied. Okay, yeah. It's H3. I think it's H3. Yes. Yeah, contact tracing. And so one of the, you can see here that the policy levels that are in our models for contact tracing, which is in the far right-hand column, are levels, pretty much levels 1 and 2. Okay, and levels 1 and 2 of contact tracing are limited contact tracing and comprehensive. So it's pretty, you know, I don't think anybody really has comprehensive contact tracing. In my opinion, you probably know a lot better than me, I imagine.
Only China, really.
Yeah. Yeah, so we don't have a lot of variation here. And then comprehensive contact tracing, I think it's theoretically available, but not implemented comprehensively, I would say. Okay.
So it's not one of the ones you checked against how the infection rates were rising or falling. Yes, South Korea too, actually.
Yeah, we did check it. Contact tracing is extremely low in our analysis. Can you see here at the bottom here? Now, again, this is the marginal impact. This is the marginal impact given what a typical jurisdiction has implemented of a little bit more. Okay, but what we're seeing is contact tracing is not there. Now, my opinion, okay, my opinion is that it's because there are a lot of problems with the implementation of contact tracing. A lot of problems with actually making it work. And I actually wrote a different paper about that, which I'd be just delighted, Rhonda, to send to you and get comments on. It came out of Policy Options, and I hope we can be in touch about that. But this is, you know, since the beginning of the pandemic, marginal investments in extending contact tracing to the next policy level, for example, have not had the same impact as, for example, you know, closing internet internal movement within Florida, you know, so, or within a state, within a jurisdiction, as we model it.
That's great. I really would love to get that. And I saw a note about once you get to a certain point, it doesn't help. But I think the issue that I like that you did here is you sort of said, if this policy is at this level, you make a major change in some of the three that you talked about, it makes a major change in those numbers. And so everything I've read says that, you know, the ones that have been a lot tighter and harder and, you know, enforced really strict problematic policies in some of our view have actually been able to manage those numbers a lot better.
Yeah, and you know, yeah, I mean, basically what I think we're very much aligned, and you know, we are learning a lot also in terms of how to do this better and so on. So you know, are there more questions, Jillian, or should I continue?
So Laura, did you want to jump in?
Yeah,
on the contact tracing?
I just wanted to add context there. So totally agree that it's probably among the top measures for managing spread, a strong contact tracing strategy. I guess the thing that's not captured here is that it falls apart if it's not resourced properly. Oh, yeah. So you could have a good mechanism in place, but then without sufficient persons, which is the case in Ontario, it can just fall apart very quickly. And I like to use the examples of schools, and because when there's a case in the school, let me tell you that the contact tracing is very high, because every mom and dad are texting each other saying, did you hear Bobby is tested positive? And everybody knows, everybody's staying home and everyone's on high alert, but that's not happening anywhere else right now.
That's right. 100%. I couldn't agree more. And Yeah, and there are all sorts of conversations, and I wonder, I don't know if it's possible, but I wrote a piece in Policy Options on contact tracing. I don't know if someone has just a second to just Google that and throw a link to that in the chat, but it just talks about how difficult it is to implement this in workplaces because of work. There's a structural difference between schools and workplaces in doing contact tracing because of the allocation of responsibilities and the conflicts of interest that arise for employers. And that's what my article is about a little bit. But this paper, as well as the next one that I'm about to tell you about, reflects my style of work, which is a big data style of work. I mean, I'm interested in trying to understand the landscape in my work generally. That is my general approach, as opposed to doing smaller studies. Although I do some small scale studies that are more that are better instrumented and more causally robust. But in general, I'm a population level thinker in the scholarship that I do, and that has some real disadvantages. And one of them is we don't know why these policies do or don't work very well from this kind of research.
Anita, let's just take one last question from Christina, and then we'll move on.
Is it going to be okay if I go over my 45 minutes a little bit?
Oh, yes, no
Okay.
worries. We are well into it. We're flexible here. Christina, you want to ask your question?
Yeah, Anita, you'll be shocked to know that I'm curious about complementarities, because you could push super hard on something, and if there's something else that's kind of a limiting factor, or you've already gotten into diminishing returns, you're not going to get much marginal kick. But if you get the right, recipe together, you could get a lot of return.
Yes. So first of all, Christina is my beloved colleague in our group in the Rotman School, and there's quite a bit of wonderful work that she's doing on public policy that I think is of super importance to SRI, and I'm thrilled that you've been here for all the talks, Christina. So if you go to that one of the links that I posted in the chat up at the top at the very beginning, there's a little model that you can go to that Fabo developed on his, when it's on his website, fabo.shiny app something or other, and you can see that he provides you with a way of modeling for each jurisdiction the complementarities. Okay, so what you do is you put in the public policies that you're interested in modeling. Like, let's say you were the governor of the state of Florida. You could look at the marginal, you could estimate for Florida the marginal impact of going from level 2 to level 3 of workplace closings. Okay, and we had to do it that way because we can't report for all 38 jurisdictions every possible marginal combination of policies. So we put into our analysis a link to a website where an individual policymaker could do that. So this chart shows the painful truth on the margin on average. Okay, this shows sort of the contextual piece that just basically says, you're going to have to you're going to have to get compliance, or you're going to be in the terrain of having to do this painful work. Okay, all right, you're nodding, so I'm going to just continue. All right, okay. The second paper that I wanted just to spend or analysis that I wanted just to make you a little bit aware of is the one that Jack was referring to when she mentioned that she had seen me last week on something or other, heard me on something or other. This is an analysis of Canadian mobility and proximity during the pandemic. And this analysis was supported by cell phone data, smartphone data that I got from Cuebiq Corporation. I will share with you that, that there is a very robust conversation going on within the university about the SafeGraph data, which is does not involve the same level of anonymity and privacy enhancement and rules for researchers on not doing individual level of analysis that Cuebiq employs. And it was a lot of work to get research ethics approval for this work. And the university is really strongly concerned with individual level privacy in the research ethics process. So that was getting this data and getting it through research ethics board approval, both from the University of Toronto and at Cuebiq itself, which is very concerned about preservation of anonymity and so on, and privacy was a big piece of work. It took 6 weeks or 2 months or something to make that happen. So that's very important. And this data is now here at the university, and I want to invite anybody in SRI who's interested in it to be in touch with us, because we've spent really the majority of the summer getting this data prepared for analysis and ready to be used. So this is analysis of Canadian cell phone proximity and mobility here. I'm just going to show you the results here, and then I can I can tell you a little bit about what they mean. We can talk about what they mean here. But for each of the 30 major jurisdictions in Canada, what we reported, and this was a report that came out that just describes the data that was published by the Innovation Public Policy Lab at the Munk School, which is just an amazing group of friends that includes by Dan Bresnitz and David Wolf, includes Janice Stein, Joe Wong, Shiri Bresnitz. It's just it's a cool place. It's not as, I would say it's of commensurate coolness to the SRI in terms of it's you know, the warmth that people bring to the engagement with each other's work here. So the Innovation Policy Lab published this as a policy report, and I just got overwhelmed with interest from the Canadian media about this. And I think one reason is that Canadian media is starved for information on Canada. You know, I really think that we're so tired in Canada of having to rely on insights from data on the US maybe, and maybe also other parts of the world, but here we have the information on Canada. So what this shows is for each of the 30 largest census divisions within Canada, so broadly speaking cities, but we're measuring by census division. So Ron, you know, there'll be diversity within census divisions, but this is the Toronto Census Division. It shows our daily mobility and our weekly mobility between January 1st and October 6th, okay, measured in the number of kilometers that each smartphone that was captured in this data traveled from its overnight location. Okay, so average daily mobility on January 1st of this year was somewhere around 7 kilometers, measured by this thing called the radius of gyration, which is, the radius of gyration is the average number of kilometers that you are on a typical day during daylight hours from your home location. Okay, so it's 7 kilometers on January 1st or so. And then we also have we smooth to weekly mobility here on the right-hand side. The weekly measures are higher because it's capturing a larger maximum difference. There's a larger maximum distance in a week than there is in a day. Anyway, you can see the pattern is very consistent here, and a large drop in right around when I left Canada. I left Canada on March 9th, intending to be away for a weekend. Okay, and I'm still where I am now here. I left March 9th, and you see this massive drop, and then a recovery in mobility. Now, the recovery is not just normal summertime levels. Okay, it's to levels that are higher than we had in the winter, but in a normal Toronto summer, you would think there would be even greater mobility than what we actually show. Okay, the real interesting result here that captured the attention of the media last week was the daily proximity has stayed low. Our proximity measures the number of cell phones that each cell phone is proximate to for 5 minutes, for at least 5 minutes an hour, on average. Okay, so daily proximity back in January was our cell phones in Toronto were interacting with about 7 other cell phones, 7, 8 other cell phones on a typical weekday. Okay, that's per hour, excluding nighttime. Now we're down to less than 3. Okay, so that's a lot less proximity. Okay, this analysis also showed movements into and out of neighboring census divisions. Okay, so for Toronto, the neighboring census divisions were Durham, which is, as you can see here on the map on the bottom, which I just plunked in here, is to the east and northeast of Toronto. York, which is to our north. Peel, which is Mississauga and the communities like Brampton and so on. Halton is down here around Oakville and so on. I just put this here in case there's anybody on the call who's not from Toronto. I don't know if that's true or not, Jillian. Do we have some non-Torontonians here?
The membership is pretty much Toronto, but I don't know where anybody is. I don't know where you are, Anita.
I'm in Cape Cod, Massachusetts. I'm in Cape Cod. And the reason I'm in Cape Cod is Sarah and I have a cottage here, and we came here for a weekend in March. And then our flights got canceled, and the university, like the day after we got here, the university closed and our flights got canceled. We rescheduled them for a few days later. But then every few days, the border closed, and then we heard there was COVID in our apartment building in Toronto. So we thought, well, why don't we stay here for another week, at least till that resolves. And then pretty soon, you know, it was summer.
Right.
Anyway,
right. And winter coming. Yeah.
Here, so we decided.
Well, people can throw into the chat how distant they are from Toronto now. But anyway, carry on.
Sure. But I imagine that most people on the call would know where these places are. Anyway, what we're seeing is that movements from Toronto to neighboring census divisions are down even from January. Okay, they've recovered somewhat, but we have this on the prior slide, this increase in mobility. But it's you know, to say that in the middle of the summer, we have less mobility between Mississauga and Toronto than we did on January 1st, which was a holiday, which is what we indexed to. That means that most of our recovery and mobility is very localized, right? It's not being driven by interregional travel, right? It's also not being driven by airport travel. I'll talk about that in just a second. But what we did was we generated these charts for the 30 major census divisions in Canada. I've just shown you Toronto. Here's Vancouver. Okay, so you see the recovery and mobility for Vancouver. Same general pattern. There's a bump up in proximity in a lot of locations, not as much in Toronto, but in a lot of locations in the summer, and then a reduction again in the fall. So we started to relax on our social distancing, this looks like, in the summer, and then it drops in the fall, okay? Vancouver, there's more travel between some outside jurisdictions. It's interesting, one of the most frequent outbound travel destination from Vancouver is Calgary. That didn't recover very much, okay? But the more localized, you know, the closer jurisdictions comparable to the ones I showed you for Toronto, like Fraser Valley and Victoria and Squamish, did recover, okay? So a little bit more interregional travel around Vancouver than we had in Toronto. Montreal, way down low. Now I want to show you this in part because in a second, I want to show you how the media responded to this. And one of the things that came out in a Canadian press report is that Montreal was doing better on its social distancing than of these other cities. In other words, I struggled as the media responded with not getting scooped up into a kind of normative, you know, city to city rivalry on what these results actually meant. Calgary, pretty low, looks a lot like Toronto actually, except for the interregional travel. And then we had some smaller places as well. I'm just showing you some of the patterns for cities that are lower in the list of the 30 top jurisdictions. So this one's Guelph, Wellington, Guelph, Same general pattern of recovery in mobility and persistent drop in proximity. This looks a lot like Toronto here in terms of the recovery and local mobility here. So Red Deer, which is between Edmonton and Calgary, proximity is bouncing around more for Red Deer, but it's really low in an absolute sense anyway in the first place. So I'm getting interviewed by, local media in these places that never have seen data coming out of the University of Toronto on COVID proximity for their town, and I'm saying, well, look, don't conclude that, a place like Red Deer has higher proximity from this pattern, because the absolute amount of social, social distancing was really low. Social distancing was really high. Proximity was really low in the first place. This is Okanagan, same pattern. So when you get deep into these 30s, the lower the cities that are lower in population in our research, you find higher levels of social distancing anyway, so the drop is not as great. Okay, here's our airport analysis, and just to give you a sense of what this is about, is we are capturing the number of cell phones per hour going through the airport, or within, I think it was a 3-kilometer radius of the center of the airport. And we find a pretty consistent pattern. This is Toronto, Vancouver, Montreal, Calgary. Okay, we look at the 7 largest airports. Boom, march way down. Now, this is going to include not just travelers, but also taxi drivers, personnel at the airport, anybody who's near the airport. We could pick up your cell phone here. Okay.
Anita?
And this is all, yes.
Yeah, just want Ron had a question about, do we know what the coverage is for Cuebiq?
Yes, it's about 840,000 cell phones.
Okay.
Does that answer your question? What I want to make sure I know what you mean by coverage.
Yeah, that does. I mean, I think it raises some doubt about how accurate the pairs are trying to compute proximity, since you take the square of the coverage, it's pretty low, right?
So what we do is we have the geolocation data. We have the latitude and longitude of the cell phone. All right. And what we're trying to do is estimate, given the density of the population and the amount of cell phones that are in the data, what the proximity is in the population. So we're basically backing out from the amount of coverage to the population. Okay. So our errors are going to be greater in lower population cities. So let's say Cuebiq has coverage of 15% of the population of Toronto. Okay, we're extrapolating from the amount of interaction that we measure what it would be for the population for Toronto. We can talk about this later, but basically your point, which is well taken, which is that an advantage of the SafeGraph data over the Cuebiq data is, these are the two main competitors that provide this data. The SafeGraph data is much easier to get, but the advantage of the SafeGraph data over the Cuebiq data is there's, I mean, as many as 2 or 3 million covered cell phones in Canada. The advantage of the Cuebiq data is that it's privacy enhanced and anonymized, and it went through research ethics approval here. Okay, so there are trade-offs between the different sources of data, because this is so privacy enhanced. It's opt-in. Cuebiq data is opt-in. SafeGraph data, I believe, is opt-out. So there's a lot of different types of bias that could be in this data. Okay, who would opt in? You might think that, I don't know, I'm just putting this out there. I don't know if this is accurate, but you might think that people who understand about privacy and the risks of opting in might not do it. So it might skew the opting in toward perhaps, more vulnerable populations. I don't know. On the other hand, dorms and cell phone, maybe more vulnerable populations don't do that. So there's a lot of subtleties here that are on my mind as I'm trying to explain these results to the press.
You
know?
And, yeah. Gia, did you want to ask your question?
Yeah, so I think that's very interesting data set and study. I'm very interested in do we have any information about demographic about the owners for this? Yeah, I think
it's privacy enhanced. I mean, Cuebiq refuses, when we were doing our analysis, so because we have the longitude and the latitude of each smartphone in our data set at night, we could potentially look at the longitude and latitude of a cell phone that's at the location of Jillian Hatfield's house and figure out that's Jillian Hatfield, right? But we had to sign a release with Cuebiq saying we would not do that, saying that we would not do that. Okay, that we would not try to make any inferences about about individuals, the individual owner of any smartphone. Okay, and this is super important to the ethics of this. And every time I did a interview, I got asked about this. Every single person, when I was talking about this to the CBC, the Canadian Press, to Global TV, when I was, Matt Galloway, everyone wanted to make sure that this was privacy oriented. It was a critical part of this of concern, a critical area of concern. So not linking this to individuals is it's part of the ethics of this. And I know the reason I emphasize this is because I know that many people who have been talking, who are involved with the SRI, are thinking about the relationships between data privacy and vulnerability of users and things like that in data governance. Am I right?
Mm-hmm.
Yeah.
Yeah. So
yeah, absolutely.
And I mean, for what it's worth, the university, when I put in my research ethics board application for this at the REB and was working with the university to write a licensing agreement that met the Cuebiq, we went through a period of pretty extensive negotiation over the license, because standard licensing agreements like the one that SafeGraph has are not acceptable to the university. So we went through a lot of work to actually negotiate that terms that were acceptable both to Cuebiq and the university, which are pretty well aligned. Okay, so there's the data governance that's happening at the University of Toronto is super impressive. For me, it was anyway in this, and very capable people involved. So really important whenever doing this kind of work, I think, to get a handle on that research ethics process before anything begins. Jillian?
Yep. Okay.
All right. So we're looking at information about what's happening at airport traffic. Very consistent here, drop and continuation of the low levels through the airport. Okay. I do want to say that this is the cover page of our report. I put a link to the report in the chat. Here's the cover page of the report. And then the second page does have, in addition to the acknowledgements, the ethics statement here that I was able to refer people to, and that I want to, emphasize as central to our approach. All right. Is there time for me to talk about a couple of other brief things? I'll try to be super brief.
Sure.
Okay.
Yep. No, we're good. We're good.
All right. I wanted just to tell you a little bit about this experience of having the media pick this up. And of the two studies that I've showed you, the first one, in a sense, is, first of all, it's further through the peer review process. The second one is just descriptives on the data. It was read and considered by the Innovation Policy Lab colleagues, but it wasn't peer reviewed in any strict sense. So it's trying to explain to these media outlets that, you know, really were interested in this, that what this study meant and all these different kind of qualifications was really important. So this is the Canadian Press headline that was out, which is, it says, Canadians are interacting and traveling much less during the pandemic, cell phone data study shows. And then this thing went on, and I'm not going to read all of this to you, but there were 3 things that were highlighted in a pretty long Canadian Press story. By the way, this Canadian Press is like the Associated Press in the United States. This got picked up. This story got picked up by, I don't know, I think at least 24 different local newspapers here. It talked about our number of Canadians that were covered here. It gave a broad overview here of the results that was pretty accurate. Some quotes from me here, and I'm a little bit queasy about some of the things that I said, but I said things like, Canadians should be really proud of this. It's quite an achievement to stay socially distanced during the summer. Okay, there's a little bit of competition between cities. So how did Toronto do relative to Vancouver, Calgary, and Montreal? And this story is the one that said that Montreal did the best. And this, I don't know if you can see up here, it says Vancouver did the worst. I bristled at this because, of course, there are subtle differences in the initial levels of social distancing, so that the drop isn't as great. The fact that the drop isn't as great reflects in part the fact that the starting point was lower. But anyway, you can't sell news stories, I don't think, if you don't make really strong claims. And so that happened. And then this one really had me a little nervous, which is this idea that more limits on mobility may not reduce interactions. I made the point we made the point in the report that because our proximity levels have stayed low, that we have to think carefully about the marginal impact of more restrictions. We're already pretty socially distant on average. Is the economic burden associated with deeper restrictions going to be worth it? Okay, I personally believe that some restrictions are important to prevent outliers. It's worth it to prevent outliers, like through big gatherings, but dealing with marginal versus average effects in the news doesn't really cut the potatoes. You know, they really want, you know. So the next thing that happened, and I don't have time for this, but I put in here a video to a global news story that I did on TV. And there I am on TV, it's a live interview. First question the guy asks me, and it's about a 6-minute interview, which was pretty long. If you're interested in this, the first question that is asked to me of the reporter, who was very nice, was, what does your results show? And I was able to say, okay, there was a big drop in mobility, and then we recovered mobility, but mobility changed a lot in its nature. No more international travel, not as much international travel, not as much regional travel, as much more local, but proximity stayed low. I was able to get that out. Then he says, he pitches me a question, which is, what does that mean for the restrictions? Like, does that mean we shouldn't have restrictions? And you can see me on the video, if you watch this, struggle momentarily. Because first of all, that wasn't a question they said they would ask me. And secondly, as a public health advocate, I don't want to say that we shouldn't have restrictions. I don't want to come out and say that more restrictions aren't a good idea, because the situation is more complicated than that, right? I want to say that on average, our social distance is say low, but that doesn't mean there aren't a few yahoos that are going out to nightclubs causing hotspots to emerge. And I got through it relatively unscathed, but it was hard for me in the moment to not overstep what the research actually showed. And here in my answer, I draw on the first paper, as you might imagine. But I think, you know, as scholars that are seeking to have impact, you'll see I had a struggle in this interview with trying to stay true to the complexities and the limitations of my research in a way that met the needs of the media. okay? And I was so affected by this experience that I wrote an op-ed that came out in the Star. It was on, I think it's actually still, it might still be on the op-ed page. It was for a week. It was the lead thing, which is to say, I basically say, in the battle against COVID, Canadians have accomplished a lot, but we need to do more. And I explained what I felt. This is my last slide, Jillian. Okay, so research, you get research to findings. You got to make choices about the framing of your research questions, dealing with bias in the data, dealing with naming conventions, like, do I call this social distance or do I call this proximity? Elected proximity. Findings, you know, these are retrospective studies that are looking at what's happened till now, but the news only wants me to talk about what's going to happen in the future. That's what makes this news. The findings have all these contingencies and subtleties and margins of confidence and accuracy, like Ron and I were just describing. And there's just there's no time in the media for dealing with that. When you're disseminating and talking to the media, you know, you're being pushed by the interests of a lot of diverse players with a hand in the game, like, you know, funders of your work. The university is very much involved in these media discussions. There are PR people and professionals. The president of the university actually asked me to get involved back in the summertime when I had done a number of media interviews on even some prior work on COVID. He asked me to talk to some funders, and Merrick is amazing. He's wonderful and very sympathetic to these issues. But the university has a lot at stake. Of course, the public has a lot at stake, and the media is primarily controlling the process and trying to make money and compete with other media outlets with good stories. Communications are hard under even the best of circumstances, and having an impact on policymakers. So the policymakers, in my experience, have wanted more nuanced information along the lines that Christina asked me about. I did get a call from some friends who were in policymaking in Ontario about whether our research could be replicated weekly to help inform what the policies should be in Ontario. We don't have the resources for that. And of course, they want more fine-grained information than our REB application would have allowed us to provide. Like, they want to know whether or not Jillian Hadfield caused some problems in a particular place. Like, they want to do contact tracing and stuff. And that's not what we're up to. And the policy implications here also involve competition between jurisdictions, which is very subtle and challenging to deal with. So I wanted to, as an SRI affiliate, you know, just share that experience with this community in the hope that together we can try to, you know, take on the totality of the challenges in doing this kind of work.
Oh, that's great, Anita. I wanted to see if anybody wants to talk about that dissemination point and sort of that contribution to the public conversation and science. Does anybody want to weigh in on that? I have some thoughts, but I'll also see if anybody wants to jump in on that.
I just note one thing, which is one of the ideas of having engineering is that we might have more capability to take useful research like this and where it's valuable for policy, make it maintain it as a useful artifact. I can follow up with you offline because we're doing some related work already at Vector with some other folks in SRI, but more broadly, like that's exactly in my mind where engineering can be useful, right? That it's hard to sustain out of a research group ongoing maintenance of technical results, right? It's not typically the mission of a research group.
Yeah, absolutely. That's great. Thank you.
And maybe if anybody's put a hand, Ron, you have your hand up, please.
Yeah, no, I'll be quick. I experienced the same thing, Anita, when I did work with people on the autism spectrum and other sort of neurodiverse disorders, and use of tablets like iPads, like that was years ago, and it was this zooming in on like a very specific question that wasn't the question I was asking. Like, you know, should you give everybody on the spectrum an iPad and they'll communicate? Yes, that's what you're saying. I'm like, no, that's not what I'm saying. So it was like coming down with these, here's the soundbite, and then I do the interview, and then I'd follow up with, here's what I said to you though, right? But you're right, they extract the bits, and then there's going to be some statements. Yeah.
The first study that I described to you, which said that we have to have compliance with the core policies in order to be able to avoid having to do these very painful economic restrictions that are, you know, that would be required to prevent the kind of second wave that we may be confronting. That's not like going to sell newspapers. So, you know, but I relied on the experience of having done that analysis and answering questions on the second paper, which everybody loved because it basically said Canadians are awesome.
Right. And then you could do the competition between Vancouver, Montreal, and Toronto.
And Calgary, you know. So look, I mean, the extent to which the message here was driven by competition, by the business models of the news organizations, and by the competing priorities of politicians that reflect exactly what political scientists say important, which is, you know, not destroying the economic or medical outcomes in your jurisdiction and expect people to like it. You know, the experience of confronting those complexities for me was not something I fully anticipated. And I, of course, did all this media work, as Jack knows, because the university wanted me to. I mean, in other words, I was compelled by, you know, we need stronger relationships in the university and the community. And we need to show that research is generating return for society, right? We need to show that all this big data and AI that we can do is going to be important. That was a very much, you know, something that I was dealing with, a burden that I was experiencing at the time too.
And let me just give you, so I think you got to pay attention to the averages, which is to say, I'm sure the average quality of the conversation and the state of information of the public was higher because of you know, your interaction with the media, and I think it's true as academics, we have to kind of come to that context to recognize, no, they're not going to get it right. They're going to say it, you know, they're going to use a terrible headline. They may get the, you know, like the Vancouver is doing worse point. They're not getting that statistically correct. But I think if we shy away from that, then I think I think we can't shy away from that. I guess I sort of feel that's always been my thought as a particularly in a public sector university. I think we have to pay attention and just. Yeah, I mean, I think you just have to kind of realize it's just not going to look like they're going to get it wrong. They're going to get details wrong, and then you'll follow up with your op-ed, and the average quality will be better.
Well, thank you for making me feel better.
But I totally believe that the average is better. And then the other piece is that, you know, we're talking about these issues now on a grand scale with how do optimization systems and platforms and algorithms, and it's really an important observation, you know, you're connecting to, which is say we already exist in an environment where all these incentives are at play to shape our information environment. And the fact that the only way to communicate a lot of these ideas is to in fact strip out some of the subtleties. You know, when you talk to your colleagues, right, you'll say there's a issue about the variance in this data or whatever. But anyway, so I want to say thank you for
thank you
for doing that.
One of the thoughts that I had, I don't know, half of what I think is not a good idea, but you know, just to put it out there, is that especially as the SRI evolves, whether or not we want to get better at this as a community, like if we want to create some sort of resource within SRI or some sort of initiative or kind of mutual, you know, commitment and resources for actually trying to figure this out a little bit together.
Yeah. Yep, and I think that's something that we want to work on too. Peter, did you have a question? You're on mute, Peter.
Oh, we can't, I don't think you're on mute, but we can't hear you.
We can't hear you. Change speakers.
Or maybe put your question in the chat.
Well, let me, Peter, you figure out your mic and I'll go to Laura.
Sure. So if I were, and then thanks for all that, really interesting food for thought. I have so many great reactions. But one is, if I were a reporter, I would ask you, we're actually doing really poorly in the second wave. We're having a worse second wave than the first. Can you reconcile that? Oh, we're listening and doing better. We're not. We're actually, right. Fauci just called us out today and said, Canada, you did really well in the first wave, but now you've blown it.
Yes.
So what do you think's like? How do you reconcile that with the analysis and what you're seeing? I think there actually is a lot of proximity data that's just not showing up, because the contact tracing data, especially in Peel, workplace and gatherings account for like 94%. And in workplaces, you would see presumably proximity measures increasing. So yeah, so how would you reconcile that?
With this analysis, we know that on the margin, this is the analysis from the first paper, the contact tracing down here at the bottom, and that mask wearing down here on the margin don't have the same impact as all this other stuff, which we relaxed. And Canada, and particularly cities in Canada, as Ron said, but Ontario and Quebec are not in this high 10% of compliance. So, what basically the way I reconcile the two things is I say, sure, we've been proximate, and if you have a chance to listen to that global TV interview that I didn't have time to show, you'll see me struggling. Now that we're friends, Laura, we've talked about this, you'll know that I was struggling because he wanted me to say, don't put in more restrictions.
Yeah. Because
there's no more social distance to be had. But what I say is, this is on average on it, but I do say we all have to make good judgments in the moment, and some people aren't. So we are all going to have to suffer with greater restrictions along the lines of this thing, because this over here is not working. That's basically what I try to say there. So the way I reconcile this is maintaining our social distance and our lack of proximity to each other. It's not enough. That's not enough to prevent COVID infection, because a few mistakes, enough COVID in the community, and enough mistakes. I'm saying that from behind a Zoom lens as a professor. I have this tremendous luxury. What if you're an essential worker? What if you're, so the virulence of this in the community, is not shaped only primarily by our average proximity. Right?
And yeah, maybe not even in a minority way, actually. It's probably shaped by other factors. Yeah.
So, the most satisfying conversation I had about this was with Steiny Brown, who is the Dean of the School of Public Health, who talked with me about this study. And he immediately, understood these relationships. His greatest interest in the proximity study was, can we take it to the provincial hearings that are going on to help them make better decisions. He was wonderful. It made me feel really great about the university to talk with him about that. It was a subtle, nuanced understanding,
Right. Thank you.
Great. Okay, Peter, give it another shot.
I'm sorry.
Oh,
Peter.
sorry, go ahead.
I think I might actually go ahead, Nita, please.
I was just going to say that, especially with this proximity data, and whenever we can bring anything from these big data sets, on Canada to Canadians that have like these deep implications for privacy policies, for net neutrality stuff, for anything like that, that, you know, finding some way of conveying the policy implications of what we're doing. For me, it's a whole separate agenda from actually just doing the work. Sorry, Peter. Thank you.
No, so I was going to say, I mean, I think as a starting position, I share Laura's. I don't know that I don't know other countries very well. There's not a country in the world, I would wager, though, that has a greater misperception about its performance in COVID against objective indicators and how well we think we're doing. So there's a very good dashboard set up by McCartan Humphreys and folks at the WZB in Berlin. And they've basically got a model where you can baseline how well a country should be doing on COVID by inequality, access to healthcare, all sorts of other factors that at the baseline should predict performance. And, you know, up to a couple of months ago, we weren't doing better than the US. We are at the same point above the regression line. Australia was at the bottom. New Zealand was way below it, you know, and we just weren't there, but we're deluded in the sense that we are. And this gets into my question just a little bit. I just wanted to, I had the benefit today of reviewing a paper for Nature Human Behavior on the Oxford data set. Like it's the paper by the folks who are putting it together, like the policy tracker there. And what's really telling about those data, Anita, when I dig into the appendices, is that they're measuring dimensions which are all related to each other in a latent sense. Mm-hmm. That their two big dimensions aren't distinguishable from one another, on a latent dimension. They both basically map onto just how hard governments are trying. You know, so what I'm wondering is how we think about estimating marginal impacts. I mean, so there's complementarity there, which was brought up earlier by Krista very, very, very wisely, I think. There's substitution, and there's just kind of overall effort, right? And policy is often not about calibration, but about signaling importance or salience or being representative of how much government's just focusing on something, right? So one question was, you know, if there is so much contamination basically between these measures, how well can we estimate marginal effects? That's the first thing. And then the second one is, I'm just really interested in your thoughts on kind of the degree. So I've played with the dashboard, for example, the degree to which we can be comfortable about the estimates of the reduction in growth rates when the disease is the virus is so nonlinear, in the sense that, you know, it's you know, where you are on the curve really matters for how big of a reduction you get in the growth rate based on where you are. So if you could just kind of walk us through, like, what's the intuition of the model behind how you're estimating reductions in growth rates? Is it averaged in terms of where they are, you know, the average point in the slope, or is it irrespective of where you are on the slope in terms of growth? That's the second question. The first one is, what do we do with the fact that all this stuff is kind of measuring how hard governments are trying?
Okay, so our model is nonlinear parameters in it. So it does matter where you are on the growth curve as to where we do this. And I can tell you a lot more about the way that we model this. We do model complementarities here. We use more jurisdictions to model complementarities than we report on because we have more data. We use every amount of all the COVID death data from Johns Hopkins, even though we don't have the excess data for some jurisdictions. So we're trying to think about complementarities. We model the timing of the implementation of the policies. And there are all these technical choices that we make that to try to address some of the points that you've raised, okay? And we can talk about them, but maybe we should do that offline, because I want to respond now in the time we have to the broad point you're making, which is the same, in a way, the same point that I'm trying to make, which is that all of these choices are critical, and we have to, whenever we do anything, when the choice of framing a research question and the methods we choose for execution and things like that are deeply important to the results that we report, and trying to convey that in a way that's responsible is not so direct, so is not so clear. But also, just to give you sort of the satisfaction of some broad answers to your questions, this analysis that I showed a little bit earlier gets, at least to some extent, to how hard are they trying, not just governments, but also the citizenry within a country. How hard are they trying? How much compliance are we getting? It relates to things like consistency across political boundaries, across jurisdictions, across cities, within a particular state or jurisdiction, consistency over time, things like that. How much compliance are we getting? There's a lot of variation in our data coming from U.S. states because of the politicization of things like mask wearing in the United States over the past 10 months. So this analysis is meant to be complementary to this analysis, which is on the margin of the impact. And the broad message that I tried to convey anyway, whenever I had the opportunity, is we have to take compliance more seriously if we don't want to have to go through the pain of school closings and implementation of renewed implementation of stay-at-home requirements. In other words, we have to get less kind of smug about how much better we're doing than the United States and realize it's a pretty low bar. We're at about 2/3 the level of infection of the United States per capita. That's not good enough to prevent us from having another big wave. So you're asking me the kinds of detailed questions that I wanted to be asked. That's my problem.
Right, yeah.
All right, Jillian.
Great. Let me just see if anybody who else has a question. I had a question for you, Anita, just because I think it maybe went by a little quickly for me. So how are you measuring compliance? I was reading this as announced policies, but you were also talking about the degree of compliance. Right. And I think I missed the measure of compliance. So
we modeled compliance by jurisdiction. And the reason that you missed it is because I didn't tell you about it in the interest of time. Okay. All right. We actually modeled compliance by jurisdiction. Let me see. So just to give you kind of a little bit of a sense of that. So by jurisdiction, what we did was we looked at the over time at the amount of variation around the reported level of infection and death rates, the amount of growth in the infection rates and the amount of growth in the death rates, the amount of variation over time, and the amount of the departure from the predicted amounts. So we did this jurisdiction by jurisdiction, but basically what we did was we then classified into 3 buckets: top 10%, middle 50%, bottom 40%, the amount of compliance in our data here to come up with those that little chart that I showed you.
Okay,
so we estimated it. I could tell you more about that offline.
But you estimated it based on your dependent variable, which I thought was.
No, we estimated based on what was reported.
Okay, all right.
Yeah, what had been reported.
Yeah. Got it. Okay,
over the
all right.
8-9 months or whatever we've had since this began.
Got it. Okay.
Yeah, so exactly. What we estimated was, what we did was we related the policies that were in place to the outcomes that we saw. And where we saw strong responses to policy implementations, we said that's more compliance.
Right. Great.
There's a lot more work to do to understand compliance, because with an infectious disease like this, the averages are not always really telling.
Yeah. So maybe that's all. Oh, I see Sheila's got her hand up. Sheila, please.
Oh, very interesting talk. Thank you so much. I just had a quick question. I was curious whether you looked at whether there was any data on how compliance was enforced. I certainly know some countries, had penalties for non-compliance, and that seems to be a very important factor in if compliance is the thing that we're worried about, then that's an interesting dimension.
I agree. The only sense in which we looked at that was in the sense that the Oxford data accounts for it. We didn't look at in how they were enforced. In fact, we actually excluded some countries. Our initial analysis included some regions of China, and then we excluded those regions because we didn't believe the reported numbers, to be honest, and because we thought that there was a relationship between enforcement and reporting. So that worried us that it wouldn't be informative for the other countries in our data set. Super important question. We didn't really tackle that.
Yeah, I know anecdotally, because I have colleagues in Chile, that there were consequences to non-compliance, which probably explains the high numbers there, and similarly in Greece, whereas in other countries that wasn't the case.
Yeah.
Well, I think one of the other, so you've also raised the issue, Anita, of the privacy around this, and I think this is something we want to continue talking about, because I think it's a complex and nuanced question. If we could get better data, if we could get better predictions about the impacts of the policies or ways to encourage compliance or whatever, with the capacity for more fine-grained analysis, if we didn't have to, we have to strip a lot out of that data. And I think I just want to sort of, and so you commented on sort of like the university's response and the Research Ethics Board. But I do think I'm quite worried that we're drawing the line in the wrong place potentially on this. And there was lots of people on this video call who would have views kind of across the spectrum on this one. But I do think it's worth our thinking through whether or not we want to say, look, of course, nobody should ever be able to tell where my cell phone went, where Gillian Hadfield's cell phone went. And I'm thinking, I'm not so sure that's the case, actually, because if the aggregate of knowing where my cell phone went meant that we could figure out, opening up, discover vulnerabilities, discover patterns.
Yeah.
I don't know that I don't think it needs to be an absolute that knowing where Gillian Hadfield's cell phone went is got to be the starting, especially in the context of what we're experiencing. So I just wanted to throw that out there.
Oh yeah, no, and it's a super important point. Excuse me for interrupting. The other big thing, of course, is the vulnerabilities of essential workers. One of the things that came up, for example, is during the Black Lives Matter protests right after George Floyd's murder in, was it June? I think it was in June. We were reminded by the ethics committees that we had approval, but that we could not identify the people that had gone to those protests. We couldn't do that in the data set. We were reminded that would be a violation of the restriction. But to me, that seems strong. What if these marches, these movements actually had a very large implication for COVID? You're balancing, do I go to a protest because I'm outraged at the murder of George Floyd against the proximity risk that I take by doing that? Isn't that an important thing for us as researchers to understand, here? So there are a lot of questions at that boundary that I think the SRI is uniquely positioned to help us develop answers to.
Right. Great. Okay. So Anita, thank you so much for that. It was just a wonderfully stimulating talk. And actually, we are sticking with the theme. So for next week, David Lee, one of our research leads, is going to be talking on a look at security and privacy on smartphones. So we will pick it up there next week, Wednesday. Okay. Thanks a lot, everybody. Take care. Bye. Thanks, Anita.